He wanted to be an umpire. That was his number one thing.
Michael Boyajian had just graduated from high school, turned 18, and had plans to move to Florida. But in September of 1987, a horrible car crash. Michael's Buick was broadsided.
Crash happens and took it all away.
It totaled his car and it totaled him.
Ever since that day, Michael has required help just doing the simplest of things.
He needs total care.
Yeah.
He doesn't brush his own teeth. He doesn't take his own shower.
No.
He doesn't dress himself.
He has the use of one arm.
But with the state's new no-fault auto insurance reform going into effect, the level of care Michael receives is in jeopardy. The new law slashes the amount of money that insurance companies will reimburse acute care providers by almost half.
What a slap in the face this is for the nurses that care so much about him. And what about all the other people? There's thousands out there that are in just the kind of shape that Michael is.
Rose is one of the nurses who cares for Michael. She's been by his side for 14 years.
We stayed through the whole pandemic here. We didn't go to a lot of outings because to keep Michael safe. And we love him. He's like family to us.
But Rose can't take a 45% pay cut. She and Michael's parents fear what would happen if Michael had to go to a long-term care facility.
If he had to go to a facility, he would die.
Yeah.
He would die from heartbreak because he's so used to having one-on-one.
Unable to swallow, Michael can easily choke on his own saliva. Without constant care, with a nurse in charge of several patients.
Is she going to be there present when all of a sudden he turns blue?
State lawmakers say they are working on a bipartisan effort to address the issue. Michael's parents just hope it is resolved sooner than later.
It's not fair. It's not fair at all.
In Westland, Camille Mary on The Edge.